Welcome to Own Your Heart Health. I'm Dr. Regina Druz, your holistic cardiologist. This week, we will dive into common heart health concerns, uncovering root causes, and unpacking scientific discoveries and controversies. The information provided does not constitute medical advice. Please contact your healthcare practitioner before making any changes that may impact your health. Well, hello, everyone. This is probably the most favorite of all episodes for me in 2024, because today I'd like to take you and reflect on what we have learned in 2024, what I learned personally, what I learned working with my patients at the holistic heart centers, and to translate this knowledge into top 5 things you can do in 2025 for heart health and longevity. So this will be top 5 for 2025. And you probably do realize that there possibly will be top 6 for 2026. But whatever number of things you are thinking about, and whatever is in your mind as you are thinking what you will or will not do in 2025, let's look back. And this time of the year, December, is the season to reconnect with yourself, reconnect with your family, reconnect with your friends, and perhaps give some reflection to the events that took place in 2024. So I am going to tell you about my 5. I'm going to tell you how they came about, and maybe those top 5 will resonate with you. Feel free to drop me a comment on YouTube, Instagram, or Facebook. I'd like to hear from you and understand what were your top 5, and maybe my number 1 is not your number 1. And I'd like to understand what was most impactful for you in 2024 and what you're going to take from it in 2025 and what actually you will be leaving behind. So here we go. This is top 5 for heart health and longevity in 2025. So number 1 for me was learning to give myself grace and learning to be grateful for everything that I have. This particular year, 2024, was a year of significant health challenges for me that I overcame, and we'll talk more about it in 2025. But I am enormously grateful for the way that things turned out. And every single day, actually, I start by being grateful to myself, by giving grace to myself for coming, for showing up, for being there for my family, my patients. And I actually stop and reflect in a little gratitude corner in my office. And I'm going to show to you, if you're watching this on YouTube, that is fantastic because you will be able to see it. If you're just listening to it, you can actually hop on YouTube. You see that little gratitude corner, in my little office, the one that has pictures of my family and memorable moments. And every single day before I start my work, I go onto that gratitude corner and I reflect for all the fantastic things that I already have in my life. And that resets me because that gives me the foundation, right? I've been thinking a lot about how important it is for us to practice gratitude. And some people like to keep a gratitude journal. Other people, I guess, a little bit more of the cuff like me, they just give gratitude in their thoughts. But whatever might be a useful strategy for you, the number 1 heart health and longevity thing for me in 2025 will be to continue to show grace to myself and to be grateful. Now, the grace to yourself is essentially a recognition that you are human and you are vulnerable and you are not a machine, and you have to give yourself a pass even if you didn't do certain things right. It's a learning opportunity. We all learn from our mistakes. We also learn from our accomplishments. And sometimes the smallest thing, the thing that is invisible, essentially, the one that is nearly impossible for others to notice, may have taken you the biggest effort. And that could be that small step, that incremental thing that will open doors to the entirely new trajectory. So give grace to yourself. Be curious, accept yourself as you are, recognize yourself as a human being as you continue to move forward into the 2025. That brings me back to my number two thing. So, what is the number two out of the top five for 2025 for heart health and longevity? And I call it mindset reset. Now, this may not be what you think, because the mindset reset that I usually speak about with my patients and some of my colleagues, and of course my family and friends, is this: there is no magic out there. I'm sorry to say this, and I know if you do believe in magic, that's wonderful. And so do I. I believe in certain magical things, but there is no magic when it comes to changing the trajectory of your health. There isn't any outside agent or agents, whether it's supplements, peptides, bioregulators, advanced blood work, genetic analyses, epigenetics. And I'm a hardcore scientist who loves all of these things and incorporates them in her daily practice. And we actually work with a multitude of these things to shift the health trajectories of our patients. And what I learned through this experience is that these things are not magic. They're not magic bullets. Instead, the patients themselves, we as human beings, when we take accountability, when we are coachable, when we are consistent in our effort, when we are compliant with what we need to do, that's when the real magic happens. And this real magic comes from connection, it comes from collaboration, it comes from partnerships. It is not really predicated on any specific supplement or peptide or blood work or genetic work. Instead, those are just the tools that help a person who is accountable and determined to unlock their own magic. So the mindset reset, it's really about understanding that the magic lives in you. If you are looking to make a shift in your health in 2025, heart health, overall health, longevity, it is not going to come from a specific intervention. It's going to come from you understanding what you need to do, committing to a path of health transformation, and holding yourself accountable. And this is what we see, and a lot of my colleagues will agree with me. This is what we see in clinical medicine. The patients who are successful are the patients who show these qualities. They take accountability, they stick around, and they do the things they need to do, even though sometimes not all of these things work out, right? This is life, and we deal with biological systems. Our bodies are very complex, and there isn't going to be a single thing that is going to be absolutely shifting what the health is doing, certainly not in terms of health optimization and longevity, although, there are certainly plenty of things that shift things in the opposite directions, unfortunately. So this is where I would say that if you are thinking that there is specific intervention out there that is radically going to shift what is happening with your health wise, I would suggest that you reset your mind and understand that the agent of change is actually you. And perhaps that intervention may be something that helps you to unlock those powers to make a change. I had recently seen a documentary about a Christopher Reeves. And of course, he is well known for playing the character of Superman in the Superman movies. And obviously had a very unfortunate, tragic accident in the prime of his life. And he said something during this documentary, which I thought was so profound. He said that when he played the character of Superman, the definition of hero for us and for him was an extraordinary person who can do extraordinary things. And when he had to adjust and survive and even thrive on a certain level after this extraordinarily life changing event, he met a lot of other people who were affected similarly. And he came to understand that the real heroes are ordinary people who overcome extraordinary circumstances. And whatever those extraordinary circumstances are for you, the mindset reset is about understanding that the magic is in you to overcome those circumstances. That is your kryptonite, right? The kryptonite that Superman usually talks about or uses in his films, but that kryptonite is inside of you. Hi, everyone. It's Dr. Regina here. I know there are contradictory opinions about nutrition for heart health and longevity. Discussion often gets heated and confusing. There are those who push for low fat, low cholesterol. Then there are fans of a ketogenic diet. There are many anti-meat voices as well, suggesting vegan or vegetarian style of eating. With all the chatter out there on what and how to eat, my team and I decided to create a tool for patients, medical professionals to clear the clutter. It is called Holistic Heart University, and it provides on-demand courses, nutrition and lifestyle resources, information on supplements to make it easier to understand how to make healthy choices for your heart. I'm especially proud of our open office hours for program patients and the Q&A feature where you get to ask your individual questions and put us in the hot seat. Head out to the show notes for the link and use my special promo code to get a huge 20% off on our annual health and wellness subscription. The code is owner20, and I'll see you in the office hours. Now, I mentioned already that, I am a hardcore scientist, and more than that, I'm also what, I would call a gadget girl. So I call myself a gadget girl, even though I'm a grown and mature woman, but let's stick with the gadget girl for now. And this is the point, I think, if you're listening on audio on your favorite podcasting platform, you may want to actually shift to YouTube at this point, because there are a couple of things I want to show that are now more sciencey, right? So we talked about the gratitude and grace and the mindset reset, because for me, those are top two. And this is what helped me shift my health trajectory. And I see it every day in my patients, because these are the things that help them shift their health trajectory. But now let's talk about some of the tools that are part of my top 5 for 2025 that you can use if you have grace, gratitude, and mindset reset to shift your heart health trajectory and to promote overall health, wellness, and longevity. So what are those? My number 3 on top 5 for 2025 is invest in metabolic health. Now, here at the Holistic Heart Centers, and me personally, we use this interesting little gadget. This gadget that's called Lumen. It sort of looks like this big, fat, I guess, e-cigarette. You could see that this is the opening, and you blow air into it. And so what this little gadget does, it actually measures CO2 that you exhale in your breath. It takes about a few seconds, to exhale, hold your breath, and inhale, exhale, hold your breath here. And it's connected to a mobile app in your device. So this is a very small gadget, but it's very sophisticated, because it is using artificial intelligence and machine learning to tell us from your breath what actually is the energy use of different macronutrients at the moment. Are you burning carbohydrates? Are you burning fats? Are you burning both? And as device and you get more and more information and more data points, you can actually have a very personalized prescription, if you will, as to what you should be doing to improve your metabolic health. And in 2025, we will be talking in great depth about what metabolic health is, what metabolic flexibility means, what we see in a lot of middle-aged or mature adulthood, which is metabolic rigidity, and how to overcome this metabolic rigidity and why it should be reversed, because the cardiometabolic connection is very, very strong and the most impactful connection that we see between metabolism and cardiac disease of all types, not just coronary artery disease, but structural heart diseases such as heart failure, arrhythmias, which is the electrical type of disturbances, and obviously certain things are already well known. For example, we know that obesity has a very negative impact on the cardiovascular system, including direct impact on the heart muscle itself. And in 2025, we will be bringing a course on heart and obesity for the professional affiliates of the holistic heart centers. And we will be running open office hours for our established patients to educate them about some of the implications of the metabolic health and obesity and cardiac health. We will also be launching our first group program. This is a cardiometabolic program that will be using Lumen device as well as other few other things to actually help our participants to regain control and to become metabolically flexible. So invest in metabolic health is really a priority because metabolic health is linked to cardiac health, brain health, cancers, obesity, musculoskeletal wellness, dementias, and pretty much every single chronic disease, even if it's not directly related to cardiometabolic parameters, will actually alter those cardiometabolic parameters. And we had seen this through this various spectrum of multiple diseases. And so invest in cardiometabolic health is absolutely a priority. And that is number 3 for me in terms of the top 5 for 2025. So, what is the number 4? So, like I said, I'm a gadget girl, and I am in many ways a heart scientist because I'd like to have objective information. I'd like to have measurements and outcomes so that when I work on myself or when I work with patients, we don't just talk about how people feel, but we have some objective measure to see whether their health is transforming, whether their health is shifting in the right direction. And so I call this decide with data. So what data is it where it's coming from? Obviously, this device up here is part of that data stream because there are certain specific measurements. But if you're a patient with cardiac issues, let's say one of the most common issues that adults are encountering, elevated blood pressure or hypertension. If you are very sporadic in your assessments of your blood pressure, for example, you may have gone into a doctor's office for a physical or some sort of a visit, and all of a sudden you are told that your blood pressure is elevated or maybe even really high, and the physicians want to start you on medications. What are you going to do about it? And we see quite a few patients coming to us with exactly that same issue because patients say, well, we don't want to be on medications. We don't believe we have high blood pressure. How can we reverse this? And, if you're listening to this and have been listening to me for a while, you know that one of our prior episodes was a rapid response episode and was specifically on how much weight one needs to lose and what kind of weight loss it needs to be for blood pressure reversal. But in terms of deciding with data, if we don't have the data, then we don't have any visibility on what is actually shaping your heart health. And in case of hypertension or elevated blood pressure, this data is super easy to get. So for example, this is what I use, and this is a blood pressure cuff. The company that I use for majority of my devices is Whittings. They have medical grade devices and make it really easy for us to take a look at this information and put this information into our algorithms to help us understand our patients where their health trajectories are. This is a very nifty little device because this is not doesn't look like a typical blood pressure cuff, right? It just has this bar where the measurements will be taken. And in 2025, we're going to go into a couple of episodes on how to properly take your blood pressure and what does it mean and what to do if you went to a doctor's office and were told your blood pressure is elevated. What can you do about it? And I can tell you that a lot. And for you to be an informed consumer of medical information, personal medical information that comes to you, you need the data. So when you decide with data, then we find the answers. And so the quick recommendation that I can give you now is that if you've gone to a physician in 2024 in any setting, whether it was urgent care or doctor's office, whatever it may have been, and you were told that your blood pressure is elevated, and by the way, 130/80 is usually the cutoff, obviously not from a single measurement, but from multiple measurements, when we begin to be concerned that this person may have hypertension. So you may be concerned with so-called white coat hypertension, where your blood pressure is elevated in a physician's office or in a medical circumstance, but you believe or you measure that it's actually less so at home or on your own. This is where data actually rules. So do decide with data. Some of the very impactful things that we use data decisions for, in addition to blood pressure measurements, include body composition analysis. So in all of our weight loss programs, we not just track weight loss, we actually track body composition, because body composition is key to cardiometabolic health. So you could see how this is all connected now, right? We have cardiometabolic health, and we need to open the doors to that cardiometabolic health opportunity, to the opportunity to become more flexible. And this flexibility has to be based on objective measurements. And this is why we essentially are deciding with data, because deciding with data is really powerful and it brings together multiple variables for us, right? And so the deciding with data is our number 4. And it is connected to our number 3, which is the improvement in metabolic health. Hi, everyone. It's Dr. Regina here. Many of my colleagues and I are noticing patients coming to us with self-ordered blood tests. When this trend started to gain momentum, I thought it would benefit many patients. After all, who doesn't want more access to health testing? However, I see that self-ordered labs often lead to more confusion and frustration for our patients. Patients are coming in with a pile of labs, and sadly, they're not better off for it. This is why we at Holistic Heart Centers have launched Heartwell Toolkits, a curated collection of blood and genetic markers that one can get at home, focused on heart and brain health, gives you all the data you need to make informed and actionable health decisions. The toolkits can be ordered at our shop on holisticheartcenters.com. You can find the link in the show notes. Use the code TESTING10 to get 10% off and free shipping. Finally, I'm going to go into number 5. Now, number 5 is a little bit of a, broader category, and what I'm going to call it the 3 S's. So what are the 3 S's? And the number 5 on my top 5 for 2025. What are these things? And so the number 5 thing that I'm going to put out there, and it may be a number 1 for you, it's number 5 for me. The 3 S's are stress, sleep, and supplements. And let me explain what I mean by that. A lot of people have serious sleep issues, especially during the winter time in the northern climates when our days get progressively shorter, when the sunlight time is reduced, and also with some of those daylight savings times, we have a significant disruption to our circadian rhythm, right? That disruption, that sleep disruption, actually increases the stress load on our bodies and on our minds. So our entire biological system is very much attuned to the daytime and the nighttime. We call it circadian rhythm, and you know it very well. And if your circadian rhythm is fractured, whether it's the seasonal fracture or seasonal impact because of the winter and reduced daytime, or because you stay up too late at night, or you work night shift, for example, if your circadian rhythm is not optimal, that would increase the stress load on your body. And that stress load in turn will increase circadian rhythm disruption and also worsen your cardiometabolic health, right? So you see this connection. And so it is really critical for you to know what your sleep parameters are and what your stress parameters are. And interestingly enough, for the past few years, and especially in 2025, we can easily measure stress and we can also easily measure sleep. Now, what I use is what a lot of you use, and this is my Aura ring, and I have no relationship with Aura, it's just I'm the end user. And I like the Aura ring because it gives me a lot of really useful information. It measures my resiliency. It tells me about the levels of stress exposure that I have throughout the day. It provides information on my sleep and recovery. And there is a certain pattern to this information that, again, there is a lot of very heavy computational things in the background that the Aura actually reports, and it will begin to report certain things that are specific to you, when you should be going to bed, when you should be preparing for bed. Do I always follow it? No, but at least I know where it is and I'm making an effort to follow it. And what I noticed is that when I do follow it for significant chunks of time, it's actually impacting my cardiometabolic health favorably because, as you know, I decide with data. And so I do follow my body composition. And I could see that during the times when I'm more aligned with my stress, resiliency, and sleep requirements, I have beneficial gains in body composition, increased in muscle mass, and reduction in the internal fat. And so this is really critical parameter: stress exposure, stress resiliency, and sleep. So this is 2 of the 3 S's, which rounds up our top 5 for 2025. Now let's talk about the remaining S. And I mentioned supplements. And what I want to talk about for top 5 for 2025 is something I called supplement stewardship. And this is a topic that I, kind of was in the periphery for quite some time. And again, in 2025, we're going to spend a bit of time digging through this and sorting things out. But what I had seen in a few individuals who reach out to us, and most recently, we had an encounter with a prospective patient who reached out to us because this patient was using 50 supplements per day. Now, I want you to stop for a second and think about it. 50 supplements per day. Now, the holistic heart centers will have a rule. We don't allow our patients to use more than 10 supplements per day. And even that is a lot. And, obviously we can't mandate what people are using, but we could make recommendations. So it will be almost never that a patient would get a recommendation from me to use more than 10 supplements. And in general, we emphasize supplement de-prescribing and supplement de-escalation. But this particular patient was using and is using 50 supplements per day. And apparently, according to what they reported, the supplement expense for this was $1,500 a month. And I can tell you, while this is relatively rare, this isn't our first patient like this. As a matter of fact, most of my patients know that one of the first things that I do with them is that I actually very often take them off majority of their supplements and I let those supplements wash out so that we can understand what the underlying physiology and biochemistry is that is not being manipulated by supplements. Now, supplements could be very impactful when someone is trying to change their health trajectory. And as you heard already before, since we decide with data, we use data to understand how impactful or not the supplements have been as part of a comprehensive cardiovascular regimen for our patients. So whether patients are looking to reduce or even eliminate certain cardiovascular medications, for example, it could be statins, it could be blood pressure medications, as well as to change their cardiometabolic health to become more metabolically flexible or to achieve shift in biological age parameters, right? So they are specifically are being followed or wish to change their longevity parameters. And I would suggest that you listen to an episode preceding this one where I discussed the biological age, how it's measured, and actually revealed my own biological age in a discussion with Ryan Smith. So I think that would be a very useful episode for people to come back to if biological aging is top of mind for you. But let's kind of circle back into the supplements. So there is no reason why someone should be taking just buckets of supplements per day. Not only is it not warranted based on any outcomes that we know about, but it could potentially be hurtful to an individual because if they're spending so many of their resources and their body's energy and money on a ton of supplements, that means that they're usually not doing something else, right? There is an opportunity cost. That means that they're not necessarily following a diet that makes sense or nutritional plan that makes sense to them. That means that they are having issues with their lifestyle that have not remitted. And instead of using a pill for an ill, they now using a supplement for a test or a finding, right? And this is not what supplement stewardship is about. So to remedy this in 2025, I would recommend that if you are looking for heart health and longevity, take a critical look at your supplements. Are you overusing certain things? Are you potentially underusing certain things? Are certain things kind of neutral and maybe it's difficult to tell if they're actually doing anything for you? Now, we have something called Holistic Heart University. And in that Holistic Heart University, it's a community that is open to both patients and professionals. And certainly you will have links in the show notes. So please take a look at those links. And so part of that community is what we call Heart Health and Wellness membership. And the Heart Health and Wellness membership is open to any individual who is looking to up-level their heart health and wellness and understand what they should and shouldn't be doing for heart health and longevity. And in January of 2025, we're going to open a course for individuals who are part of Heart Health and Wellness membership called Heart Supplements. And we're going to go step by step through the heart supplements, the ones that are used commonly, the one that are used less commonly, what has been found and published, and how important these publications or information, how reliable it is, how impactful it is. And you will find that for each of those supplements, I will provide you with our experience at the Holistic Heart Centers, what we had seen or may not have seen in our patients, so that not only will you have information in heart supplements course that you can learn from reliable sources, including articles from cardiovascular literature and overall scientific articles from recognized journals, but you will have our clinical notes, what we had seen and what we had not seen with using specific supplements, including supplement regimens in our patient population. And obviously, we're not going to mention any specific patients, but we will present you with cases that are based on some of our patient experiences without telling you who these patients are and what no identifying information will be presented there. But you will learn through those cases why certain supplements were recommended for these patients. If they use these supplements, what effects had they observed, and what is our sort of punchline, right? Is it good? Or is it working? Is it actionable? Or is it more like, there's a lot of internet chatter and hype, but we hadn't really seen it work, right? So this will be a very useful course, heart supplements. It's our first course in the heart health and wellness membership, which is open to individuals who want to improve their heart health and wellness. You don't have to be a doctor, a nurse, or anyone. You can just be a person who wishes to know more and be an educated consumer of integrative and holistic cardiology resources. Now, we do have several courses, and we also have, of course, in the Holistic Heart University, a professional affiliate and a partner level. And those are very specific levels that not only give you access to heart supplements course that you can share with your patients, but also give you access, if you are a professional, to an integrative cardiology curriculum that you can use to uplevel your practice. And again, the links will be in the show notes. So, what's in store for us, and maybe for you if you decide to join us in 2025? Right, the top 5 for 2025 were grace and gratitude, mindset reset, invest in metabolic health, decide with data, and the 3S, which stands for stress, sleep, and supplements. So, how are we going to bring those top 5 for 2025 at the Holistic Heart Centers to benefit our patients, to give our patients an opportunity to meaningfully shift their heart health and longevity trajectories? Right? So I already mentioned Holistic Heart University, and at the Holistic Heart University, for our existing patients, we have courses on metabolic health and metabolic flexibility, including the courses using the Lumen device. And we have made this device and a lot of other devices really the digital biomarkers that we use quite a bit in all of our programs. Additionally, we have introduced open office hours where any one of our patients can drop in virtually to speak with our team, address some of their concerns. And we typically, as we answer patients' questions and learn from our patient experiences, we bring some of the pearls that we have learned into those open office hours. For example, in January, we will be starting a series of office hours to assist our patients with fasting mimicking diet, an interesting tool that one can use to really interventionally change how their metabolic health is shaping up. So I encourage you to take a look and examine that. Also in 2025, since we decide with data, we will be providing all of our patients with specific reports and allow them to map out their health transformation journey, not just in terms of their subjective experiences, but in terms of the objective measurements. So stay tuned for that, because we will be bringing those health trajectory reports for each patient, and I'll do mine first so that and present it here in this podcast forum so that you can actually see and understand what it is about. Now, I already mentioned the supplement stewardship, stress, and sleep. And a lot of stress and sleep variables will be the reporting variables that we will focus on, but we will also run programs that help our patients to utilize some of the devices out there. And again, there are digital devices that potentially could help them to shift the balance on the stress exposure and build more stress resilience and actually improve their sleep and normalize their circadian rhythm. And so we will be talking about devices such as HeartMath, which is a very specific type of a device and actually a program, if you will, that is designed to improve a person's heart coherence. So we'll be talking about what heart coherence actually is. And we will be looking into the impact of vagus nerve stimulators and how to modulate your vagus nerve response so that you can achieve relaxation and rejuvenation by doing so. So those will be very impactful opportunities in 2025 for me personally and for our patients as well, with regard to building stress resiliency, improving their sleep. And I already mentioned supplement stewardship, right? So through the data-driven decisions and objective as well as subjective measurements, and using some of the digital biomarkers devices that we can have, we will be advising our patients on the best course that we recommend to them with regard to their supplements, peptides, and bioregulators, which is always very important, right? And as much as I could tell you that you probably know what the common supplements are that are beneficial for heart health, I can tell you that in the heart supplements course, there will be a lot of things that will change your mind. So these are my top 5 for 2025. And I hope that at least some of those top 5 have resonated with you. And I would love to hear from you. What are your top 5 for heart health and longevity for 2025? Do the ones that I talked about here resonate with you at all? If yes, which one resonates? Is there anything that I may have missed that you think should have been mentioned? Obviously, we can talk about heart health and longevity for days and months, and we typically do. But this, top 5 for 2025 was just to give you some direction, some understanding where we are heading, and potentially see, whether that is something that you find useful. So drop a comment to us on Facebook, drop a comment to us on Instagram, drop a comment to us on YouTube so that I can learn which of those top 5 resonated with you and what else we may need to discuss that you found to be helpful from heart health and longevity perspective. I also want to remind you that we have multiple resources in the Holistic Heart University, and stay tuned for the announcement about our group program. It will be launching in mid to late January of 2025, and it's our first cohort will be fairly small. It'll be about 10 patients or so. And I do have a surprise for the first 5 patients that will step into that first ever group. And so If you want to know what that surprise is and consider being one of those patients, you will need to comment to me on either Facebook or Instagram or YouTube. Just comment surprise, and I will share it with you. And hopefully, this will be something that you can actually use. And with this, I want to wish all of you who are listening to me an absolutely fantastic and blessed 2025. I can tell you that from a personal perspective, there have been so many things that happened in 2024. And a lot of those experiences for me personally have been very trying experience. And I'm heartened to think that with the help of my family and friends, I was able to overcome some of the low points in 2024 and actually go to some of the highest heights for myself personally and professionally in 2024. And I wish the same to you. I wish you a year of peace, joy, and being an ordinary person who has the kryptonite to overcome the extraordinary circumstances, or just to continue to be grateful, graceful, and unlocking the magic of health transformation that I know all of you have. Happy New Year 2025. Hi to all professionals listening to us today. If you're thinking of launching a cardiometabolic or integrative cardiology program in your practice, we can help. At the Holistic Card Centers, we help docs in practice to expand into hybrid or concierge services. Head out to the show notes and click on the application link. Your intro call is entirely free. Ready to schedule a practice review? Use code DOC10 for 10% off our Practice Power Hour 16 minutes coaching session. The link is in the show notes. Thank you for tuning in to Own Your Heart Health with Dr. Regina Druz. This podcast is powered by Holistic Card Centers. If you enjoy the show, please rate and review us on your favorite podcast platform. To learn more about our services, visit holisticcardcenters.com and subscribe to our YouTube channel. The link is in the show notes. See you next week.